instead of telling you, no, you can't do these things, we try to work with you to figure out ways that we can protect your feet outside of your sport in order to make you function daily without pain. Hey guys, Dr. Michelle Hurless here. I'm coming at you to talk a little bit today about ballerinas. Yay! We at Lexington Podiatry see a lot of high-level athletes, one of them being ballet dancers. We see a lot of really competitive ballerinas, and I'm here to talk a little bit about protection of your feet. So we have the unpopular opinion that we understand that doing these things like pointe and ballet is something that you love and something that helps relieve stress and keep your mental and physical health in check. And so instead of telling you, no, you can't do these things, we try to work with you to figure out ways that we can protect your feet outside of your sport in order to make you function daily without pain, but also figure out ways we can do strengthening and stretching exercises and things like that to help you to be able to do your sport, but also prevent your feet from further damage. So pointe is one of those things that can be pretty hard on your joints and your feet, specifically the big toe joint and your ankles. So if I'm looking at a ballet shoe here, and you can imagine the foot being down inside of here, all of that pressure is going on your big toe joint here. So when over time, when this joint jams, this big toe joint, it can create a condition called hallux limitus. Hallux is your big toe, limitus just meaning limited range of motion. It can cause early arthritis, which leads to decreased range of motion in your joint, and eventually it can become rigid. So what we like to have patients do to kind of protect this, because we can't prevent it from happening in your pointe shoes, but to prevent this, we get you in an orthotic, so while you're walking normally outside of dance, we protect this big toe joint to decrease this destruction of your joint. Also, things that we can go over with you are doing strengthening exercises to strengthen the muscles around this big toe joint and also in your ankle, because you can imagine when a ballet dancer is in pointe like this and their foot has extreme flexion, their ankle joint can become very unstable. And so it's important to, if you are a high level athlete, to be under the care of a podiatrist so we can continue to give you education and help you to strengthen your feet to prevent them from injury. We love and support dancers. Not that you can tell, but I used to do pointe myself, and it was something that I felt very passionately about and I loved. And so we love to see these people, even if you don't have pain, to just talk about your overall foot health. That way, when you're up on your little tootsies, you get to protect your feet, but also do the things you love. So if you feel like you might be someone who you just want to have a foot health check and you want to get some advice on things you can do to strengthen your feet and keep them healthy, definitely come see us. That is something we can do for you. Okay, so that's all I got on foot pain with ballerinas. Protection is key. Having inserts in your shoes are key, and strengthening your ankles and the muscles surrounding your big toe joint is definitely key. So come see us. We'll get you all checked out. Thanks for watching. Subscribe to our YouTube channel, like our page, and ring the bell for notifications.